Have you been feeling pain in your back and pain that may subside when you lay down? If so, this may be lumbar degenerative disc disease. Sounds like a big scary name, but it isn't. Welcome back guys, it's Dr. Tom here. Today we are talking about disc degenerative disease. So disc degenerative disease, and that of the lower back, is a condition where the intervertebral discs, or those little discs that sit between the vertebrae, gradually lose their flexibility, cushioning, and ability to absorb shock. Despite its name, it's not technically a disease, but a natural age-related process. So the main causes are aging, repetitive stress, genetics, injury or trauma. Poor posture is a huge one, and having a career where you're held in a poor posture. The main common symptoms: lower back pain, and it's often worse when sitting, bending forward, or lifting. Pain relief when walking or laying down. Stiffness and reduced flexibility in the lower back. Sometimes, but not always, numbness and tingling down the back of the leg. So if we lose those disc heights, it can sometimes press on that exiting nerve root that comes out to the side, and that can cause those symptoms to go down the back of the leg. So an interesting fact is that disc degenerative disease can actually start in your 20s or 30s, even if you have no symptoms. In fact, studies show that over 90% of people over 60 have some disc degenerative disease, but not all of them have pain or show symptoms. So when we talk about exercises that are going to help us with disc degenerative diseases, so we want to do hip stability exercises, spinal stability exercises, and mobilize the thoracic, which is the spine that sits above that lower back. So today I'm going to run you through 5 exercises. Easy to do, you can do this at home, and you can do this every single day. So let's get into it, guys. Okay guys, the big muscle is called the transverse abdominis, and the best exercise for this, we're going to break into 2 phases. The first one being the easier phase, and the second one being the more challenging phase that you can either work your way into, or if you feel great in the first phase, you can jump into straight away. But ensure there's no pain, ensure you can do them properly, and let's get into it. So hands above the shoulders, reverse tabletop position, 90 degrees in the hips, 90 degrees in the knees. Now from here, locking the ribs down, sucking that navel into the table, and flattening that lower back curve into the table as well. So in this position alone, we should be working pretty hard. Now, to increase this, we're going to slowly drop one leg only halfway down, just to here for 3 seconds, and then slowly coming up. Same thing on the other side, slowly drop down, hold, 2, 1, slowly coming up. So all we are doing here, we're gonna do 5 on each side, slowly drop down, 3 seconds, and up from there. Now, the further down we go, the more we start to test that transverse abdominis. Now, the big no-no here is if you go down and you start to lift in your lower back, that means that transverse abdominis has switched off, you put too much load through it, and in doing so, we're doing more harm than good to our lower back. So make sure everything stays sucked down into the table here, and we're not going down too far. If you're happy with phase 1, stay there. For phase 2, all we are doing is the same thing. So making sure we lock the ribs down, lower back into the table, suck the navel in towards the spine. We're gonna use the arms as well. So we're locking opposite arm to opposite leg, keeping this knee bent, holding for 3 seconds, slowly up. Same thing, make sure everything stays locked. 2, 1, 5 repetitions on both sides. So you're gonna feel here that this gets pretty hard. Just having to lock this in gets pretty tricky. And you might actually need to get those 5 reps done on both sides. You might need to come down and have a little rest. All right, number 2, and this is to get a little bit of mobility through the lower back. The more movement we can get into the lower back, that promotes what we call synovial fluid through there, which almost acts as oil to a car, lubricates those joints. So when we talk about degenerative disc, that's when we're losing some of that elasticity and the fluid in the disc. So we want to promote as much fluid being pushed into the disc as possible, and that comes by movement, but movement that doesn't hurt the lower back. So all we're doing here, we're going to lock the knees together, arms out to the side, and we're just going to slowly lock the knees Let the knees drop into one side and slowly into the other. So we're going to go through and do 6 reps on each side here. There shouldn't be any pain. If you can't get all the way down, if you get to here and you start to feel pain, you've gone past the barrier. So just go to where it's comfortable, breathing in as you come up, breathing out as you drop down to the side. So get all the way to 6 reps here. This should feel nice. There should be no pain. This is a very simple one, just to get that movement into the lower back. It may be a little stiffer on one side compared to the other. But complete your 6 reps there, very slow and very controlled. For the next one, we're going to go into a kneeling position. So hands are right under the shoulder. And then from here, we're going to start by pushing away into the table, tucking the tailbone under, and then slowly flexing or pulling that lower back towards the ceiling, mid back towards the ceiling, and then tucking that chin all the way in at the top. Now from here, we're going to reverse. So we're going to reverse through the tailbone first, extending, letting it drop down towards the table, through the lower back, through the mid back, and then finally through the neck. So we always, as you can see, we start with the tailbone, flex the tailbone, flex the lower back. This is what we call segmental cat-cows. And all the way into the neck, extending through the tailbone, extending through the lower back, letting that mid back drop down towards the table, and then finally into the neck. So we're doing 7 repetitions of this, and the slower the better, and the better it is for us. So try and move each individual spinal segment. And the same thing, this will really help loosen up, mobilize the spine. We're working the musculature around it as well, which is good for us. So 7 repetitions there, guys. There should be 0 pain. As we do this over the next couple of weeks, we should get solid improvements in the amount of flexion and extension we get, which will really help the health of the discs. For the next one, we are using what we call a mini band. We are going to be laying down. We're going to place the mini band just above the knees. We're pressing heels into the table. We're squeezing, so with our heels, we want them about shoulder width, not hip width, so a little wider. The mini band's just above the knees, hands pressing into the table. As we start to lift the hips off the table, we're putting our pressure into our heels and trying to squeeze the knees as wide as possible. We're holding at the top here for just 5 seconds. And then after the 5 seconds, we're going to try and roll the spine down one segment at a time, ensuring that those knees don't come any closer together. So hands into the table, keep the distance between the knees, slowly peel that back off the table, 1 vertebrae at a time. Try and tuck the pelvis under, tuck your tailbone under at the top, and then slowly let it roll back down. We're going up to 10 reps here. And why do we do the glutes? Why are we trying to strengthen the glutes and the glute medius here, which are the hip stabilizers? And the big reason is by having a platform, a really strong, stable platform that the lower back sits on, there's less demand on the lower back. So 10 repetitions here, guys, making sure we peel the back off, we peel the back down, the glutes tuck under, the knees are as wide as possible. 5-second hold, slowly rolling the back down onto the table. And we are going into our last one. This one is designed to decompress the lower back, add a little bit of distance between those vertebral body heights, and hopefully take a little bit of pain out of the back. Okay guys, so what we're gonna do for this last one, we can put a pillow right on the edge of a table. And then from here, we're dropping, so you can see I'm up on my toes here. We're gonna tuck the toes under us and let our body, our chest should be into the table, let our body and our hips just sink towards the ground from here. So we're gonna go 20 to 30 seconds here of just trying to let everything through our lower back region, through our hips, everything sink down towards the ground. So it should be a nice one to finish off with. It gaps everything. And after that 20 to 30 seconds, you're gonna walk the feet slowly under, hands into the table, push up, move the hips around. You can stand up from there, side to side, have a little 10-15 second break. And then the same thing, we want the hip crease to go right into the table, elbows over the cushion, up on the toes, tuck the toes under, let everything sink down from there. So really nice traction one. Make sure you might need to move the position around a little bit. If you're in this position, you can't relax, it's not what it's designed to do. So move yourself around a little bit. You might need more of your body on the table to make sure that you can fully relax and just let those hips traction down. Now, there is a variation 2 of this, so I'm gonna give you both. Okay, so if you only have one little edge like this to play with, what we're going to do, sitting on the edge, feet into the ground at all times, wriggle ourselves off, keep the arms straight, and from here, we're just letting those hips sink towards the ground. So just like this, but this does require a little bit of tricep strength. So if you've got an elbow or shoulder injury, this might cause a little bit of pain, and you do need a little bit of strength through these triceps here. So that's one variation to do it. You can go straight legs is a hard version, bent legs is the easier version from this position. So like I mentioned before, guys, today's program can be done every single day. The more consistent you are with it, the more results and the better results you're gonna get. So keep it up, add it to your daily routine. Find a little part of your day that you can fit your programs in. If you have a friend that may have complained of, hey, I've got degeneration in my lower back, share this with them, it may help them. We have videos every Monday at 7 a.m, so be sure to tune in. We cover most common injuries there are with rehab solutions to help you guys. So check some of the other videos out if you ever have any niggles. And until next time, guys, take care and we'll see you soon.